Hi, I'm Mark. I'm co-founder and CEO of Bella+Duke. And on this week's show, I cover the very difficult topic of end of life. It's very raw to me still because unfortunately I had to put my border collie Trinity to sleep after 16 years. Previously I had Morpheus, who's the inspiration for setting up Bella+Duke in the first place, who I lost to cancer when he was 11. But he made that decision for me because he was ill. When you have a dog that's aging, the approach is different, and often the choice has to come from you and not your dog or your cat, and that sets up a whole set of different emotions and feelings for yourself and for your family. So this topic is very real. It's a topic that's not well covered across the internet, as I discovered myself, and we've got Wendy on this week, who's a vet with over 30 years experience. The important thing with this is being prepared and understanding the process, which I think will help you and your family. Anyway, sit back and listen to this podcast. We'll be following this up with also a blog post and links to useful resources going forward. And I want to give a big shout out to the group, the Bella+Duke group. Their support, that's really helped myself and the family get through this really difficult time.
The Pet Health and Happiness podcast from Bella+Duke, keeping you at the cutting edge of pet nutrition, behaviour and health, with expert interviews, mythbusters and more to ensure your pet lives a long, happy, healthy life.
Hi, so I'm with wonderful Dr. Wendy McGrandles. Hello, Wendy. It's been a while.
Hi, Mark. It's been too long, actually, but it's amazing how the months pass. But I'm delighted to be back again with Bella+Duke.
So I really appreciate you coming on today, and we're going to talk about a tough topic that I guess is really close to me this week, with losing one of my pets, Trin. And I wanted to bring it up because there was a lot of things going around in my head when I was having to think about it with Trin. And I've been in a unfortunate position where my previous pets had taken that decision away from me. And I think as more and more pets are getting well fed, the chances are there's a lot more people going to be like Trinity, where they're just going to get to old age, and we have to make that decision on their behalf, what's best for them, which often isn't what's best for us as humans having to deal with it. But I'd love to get your view in it, Wendy, and as we've spoken in the past, it's part of the job for a vet, isn't it? I mean, it must be, I guess a tough part of what you have to do, but it's what you've got to do.
Yeah, I mean, you're absolutely right, Mark. It's a huge part of being a vet. But more importantly, we're also here to support the owners and the family's decisions coming close to the end of their well-loved pet. I mean, I think it's important to realise that death is not the opposite of life. It's actually the opposite of birth. One of these things, we're all going to die. What's the two certainties in life? Death and taxes, as they say.
Yeah. But Newcastle United never winning the FA Cup.
Fair enough. But it's such an emotive subject. We all naturally shy away from it, not just with our own relatives and our parents, for instance, but we do shy away from it in our pets because we want them to be there forever for us. And that's totally understandable. But I think more than anything, as your pet ages, it is so important to be aware of how the body ages and what disease processes are going on. And more importantly, to form a bond with your vet so that you have a third party who can talk you through this process.
So that's a really good point. So I think if we started with what's the indicators when you should start thinking about this is, I mean, what is it you speak to your clients and you go, okay, do they come to you and say, I'm thinking about it, or is it the other way around? How is it, or is it a mixture of both?
I think it's a mixture of both, Mark. I mean, I'm fortunate. I get to see a lot of my clients regularly, so I get to know them and their animal, so you can monitor the progress. So I think first and foremost is regular checkups. I mean, any animal, say even over the age of 8, I think should be seeing their vet at least every 6 months, because 6 months in a dog's life is a lot longer than 6 months in our life. So I think it's very important that, we don't shy away from taking our pets to see a vet. And again, sometimes we do want to have an ostrich approach to this because we don't want to know. I mean, if there's something happening, we don't always want to know. But again, with regular checkups, possibly also involving regular blood tests, we can monitor disease processes. And nowadays, using a mixture of conventional and holistic care, it's amazing how well we can support our older pets.
And this could be pain, because unlike a human, you can say, "Oh, my knee's really painful." With a dog or an animal, you have to kind of guess, or.
Well, it's a difference again between acute and chronic pain. If you step on your dog's toe, it's going to tell you it's painful. But chronic pain creeps up gradually. And I was reading quite an interesting article the other day, partly because I knew I was doing this podcast. And it was saying that the difference is that animals don't have the same emotional attachment to their pain as people do. And I think that's quite a good way of putting it. They certainly suffer pain. I mean, I often get old dogs come hobbling in. And the first thing anybody will say to me is, "I don't think he's in pain." Well, I do. And that's the difference. So I think assessing pain is very difficult, but it all wraps up into this wonderful statement, quality of life. What is quality of life for a dog, a cat, a rabbit, ourselves? How do we assess this? And I think we don't have all the answers as to how we assess this, Mark. I think it's very important to listen to the family, to listen to the pet owners or guardians, because they know their own pet best. And certainly from the dog's perspective, their quality of life as a 12-year-old dog compared to a 2-year-old dog is totally different, as you probably found out.
Yeah, absolutely. And it was telltale signs. The tail, for example, for Trin, she just kept it underneath her, which, you start reading about it and understanding that's not how Trin normally is. Her tail was tucked under her belly. She was even getting down to eating. You saw a difference in eating patterns, and I guess these are big indicators, aren't they?
Yeah, you've covered some of the really important points. I mean, pain, mobility, behavior changes, that's a big one. I mean, perhaps them just wanting to go off and lie in their bed and not want to kind of engage with you when you come in from work, etc. These are all huge signs. Appetite, as you said, changes in appetite. Incontinence, I think that's something we need to talk about during this podcast, because that is a very stressful one for owners in particular. And unfortunately, it is something that comes with the aging body. So all these factors really have to be considered in this quality of life. But I do think, if your dog can't raise his or her head, wag her tail, get up and go out to the toilet unaided, I'm not sure if that's quality of life, I will be honest.
Yeah, absolutely. So I think the point that you're saying about, say, chronic disease, chronic pain, that's not reason to think about it if you can potentially manage it.
Yes.
So if you can find ways that holistically, or stopping the inflammation or whatever it is, and you'll know, again, you'll have methods to manage that. Incontinence, I mean, Trin had that for 2 years. We were able to manage that. So that wasn't so much of an issue, but yeah, she went to the toilet in the house more so than not towards the end, and that was a big indicator. And one of the things I noticed, actually, she wouldn't pee when she went out for a walk.
Yeah, absolutely, because it was painful to do so. That's probably the most common reason for it. I agree with you. I mean, it will not be uncommon for your really elderly animal to occasionally either urinate or defecate in the house. Sometimes they're not even conscious of doing it. There is some medical management, particularly for urinary incontinence. You can manage it reasonably well. There's some herbal options. There's some holistic options. Even just changing the dog's environment can help. If you've got a couple of steps to go out into the garden, putting a small ramp in there might encourage them to go out more frequently. So there's lots that you can actually do with the environment that your pet's in to just try and ease the last few months or few years or whatever it is going to be. One of my bugbears actually is I think we should definitely teach all our puppies to use ramps, because we suddenly get to 8, 9, 10, 11, 12 and we go, yes, get him a ramp. And the dog goes, you're having a laugh. What am I supposed to do with this?
I'm not a circus. Yeah.
I'm not. No. Whereas I happen to have a pup who had a lot of elbow problems, and she learned to use a ramp from 6 months of age. So she doesn't use it now, but I definitely know when she gets to real old age, I'll just get the ramp out and she'll go, oh yeah, I remember this one. So I think that's one of the things we should be teaching all our puppies, to go in and out of cars via ramps for certainly the first year of life.
That's a great point. I mean, and it's fine for me to pick up Trinity, but my parents, they couldn't do it. They couldn't pick the dog up if they were looking after Trin.
No, I mean,
so it's not just you. It's other people who may be looking after your dog. You got to allow them. If got a 4x4 is different to the back of a little estate car.
And it's the same as the environment, obviously, in the house as well. More and more of us are going for wooden floors for obvious reasons. But older dogs do struggle with that kind of flooring. I've got 2 13-year-old Labradoodles at the moment whom I bred. So therefore, I've known them since they were little eggs. And, they're starting to have issues with the stone floor that we've got in the kitchen. So we're putting loads of mats down. So again, it's looking at the environment to just say, what could make this a little bit easier for them to get up and down, get to the water bowl? How can I help them eat if they've got sore necks? Can I feed them from a height? I mean, there's loads of good tips out there, obviously, on the internet as usual. And I just wanted to mention actually here where I got a lot of this inspiration for end of life care is actually from an American vet called Dr Mary Gardner. And I would encourage everybody to go onto her site. She has loads of tips. Yeah. She runs a hospice franchise throughout America, and it's one of her areas of expertise. And she's really good at just simple tips that you can maybe do as your animal starts to become more incontinent. Some physio techniques, constructing a thing called a sensory road just to try and help their balance and their mobility. And these can be done obviously not in the last week of life. I mean, we're looking at probably the dogs of 8, 9, 10 who are maybe starting to lose their mobility a little bit. So I would encourage them to go to Dr. Mary Gardner. What I'll do for you, Mark, is I'll send some links through and you
Fantastic.
Can them and let people have a look. She's also got an app, by the way, called the Grey Muzzle. It's a little bit basic, but it's to help you actually score your pet's quality of life, because this is a very subjective subject. And therefore, I think if you've got some technique or some tool out there that you could start to score a little bit of how the days are going on. And certainly I would agree that, coming to the last few weeks of life, these scoring techniques can be awfully useful to help you make the decision. On a sort of broader way, I just say to my clients, look, monitor them and decide, have they had a good day? Have they had a bad day? If you've got more good days than bad days in a week, fantastic. But if you've got 6 bad days and 1 good day, we need to have a longer chat about this.
And I think on reflection, Sadie and I were also thinking, well, what is a good day as well? Because a good day is maybe based on the last 2 weeks worth of bad days.
Yeah.
So, and I think you have to, and it's tough. You have to keep just, refreshing it. Was that what she was 2 years ago? And if not, then it's the best of a bad set of days.
Absolutely.
And I think that, and I think your point, around pain, it's not obvious. It's not always obvious. Like you say, they're not urinating because it's painful, and they're urinating at night because they just really need to go. And I love that. Is that right? I do love that that scoring system, because I was looking for something like that to take it out of my hands a little bit, which would have helped us had we known that. So I think definitely that's great to share with other people.
It's slightly basic, but I think at least it gives people pointers, because again, if it's the first time you've had an elderly animal, then it can be very difficult to really adjust to what they're experiencing in life. And it's so different from really our experience, I have to be honest with you. I mean, we do not euthanize humans yet, anyway. And I think we have to be careful that we don't look at euthanasia as a terrible thing. I actually look at it as a gift to stop suffering, because death itself is not a pleasant experience.
Absolutely. Well, you said that because in the wild, it's a completely different.
You don't get old in the wild.
No.
That's nature. You don't get old in the wild. You get picked off, and it doesn't really matter whether you're a prey animal or a predator. As you weaken, you get picked off because nature only wants to have the strong and the best going forward. Our animals are not in a natural environment. Let's never think they are. No matter, we feed them a wonderful natural diet, but they're still do not live in a natural environment. Therefore, we need to make these decisions for them or on their behalf. And it's all about stopping suffering. I mean, all we should think about as far as the word euthanasia is concerned is that it is an assisted medical death.
Yeah.
Stop suffering. Otherwise, you can die a horrible death, I have to say, and a horrible experience for the family to witness as well. If your pet curls up in their basket overnight and pass on themselves, look at it as a gift from them, because it doesn't happen very often.
Yeah, it's not, and especially if we're going to feed them right, you're going to, arthritis in a dog just slowly creeps on. It just comes with wear and tear, and as dogs get older, these things are just going to creep on you, and that's certainly the case with Trinity. For us, it was just that. So the things as a pet parent is you just got to, your pet better than anybody else. You just got to look at the body language. We spoke a little bit about the tails. You spoke a little bit about them going off, maybe sleeping in a different room.
Yeah. And one of the things, Mark, I see most from owners coming in and talking to me is this increasing anxiety that you get with age. Our pets become more anxious as they get older. And you see that reflected in them pacing around the house, not settling, maybe turning night into day. That's a common expression that I get used, where they sort of from, middle of the night or even sometimes just after bedtime, they're up pacing around, panting, won't settle. Now, some of that can be pain, and I think this is why it's so important to take them for regular checkups. Have a discussion with your vet over pain management. There's loads and loads of ways to do it, and it doesn't all involve drugs nowadays. There's acupuncture, there's laser, there's lots of other techniques available to help. But this panting, this anxiety, pacing around is a real problem for a lot of dogs in particular. Cats do it as well, but to a lesser degree. But dogs will do it. And some people reckon that it's because they are predator animals, and that it's because they're starting to lose that predator status in the pack. So they're starting to become prey, as in if you lie down and you're weak, somebody else might get you. So obviously this is all just hypothesis, but there's a few papers out there saying that this is why dogs do all this pacing around, panting, etc., etc. So it's all to do with, there are medications available to help with anxiety. You need to certainly check for pain. If your dog sleeps all day, you can't always expect it to sleep all night. Granted, some of them will sleep 23 hours out of 24, and old cats most certainly like to sleep 23 hours out of 24, but
like my teenage kids.
Break up their day a bit, break up their day a little bit. It sounds awful, but just say, look, come on, let's go out for 5-10 minutes into the garden and have a potter about, etc., etc. All that type of thing, will just maybe help them sleep better overnight as well.
Yeah, absolutely. And interestingly, again, I'm going to relate this back to Trin. She was losing her eyesight and she was getting deaf. I'm assuming that has an impact as well on her confidence. And
yes, they do lose confidence. I mean, sight and even hearing's not the most important things for dogs. Sorry, you probably hear my old 13-year-old female Labradoodle snoring in the background. Because
I wasn't going to say nothing. I just thought
she snores nowadays. So she's just been out and she's come back in and she goes, I'm snoring. The whole thing is that you've got to find ways to support these animals as they get older. And as I was saying to them, their senses, the last sense to ever go, and I'm not even sure it does go because we don't monitor it, is the sense of smell. That's dog's big one. That's how they survive in the wild, is their sense of smell. So sight and hearing going is not quite so important for them, as long as you don't move your furniture around every 5 minutes in your house. So try and make the environment easy for them.
And we're all getting a lot of deliveries at the moment, so there's a lot of boxes in the middle of hallways that we have to remember move that out the way. They get used to it. Now, that's great. So so we spoke a little bit about the pet's emotion. So they're also going to pick things up off you as the owner, isn't it? And I think the gift that we can give to our pets is we know what's coming, they don't.
Correct.
So I think it's important to take those last few days. And one of the things that I hadn't taken into account is we wanted to have Trin put to sleep or lay to rest at home this time rather than in the vet. So we had a bit of time to prepare. And God, that was heart-wrenching, when you know this is going to happen, but you're doing it for your pet. You're not doing it for you at this point. And it gives you time to take all those photographs, goes on those walks, those favorite walks, short walks.
Yeah.
So you've got good memories. That really did help us.
Again, it's all about this discussion beforehand. And I do encourage people to go and speak to their vets. I mean, it's part of our job. It's the one thing that we can really help you with. I mean, we go through it, I hate to say, almost on a daily basis. Sounds a bit macabre, but it is true. We do go through it regularly. So we can help you with the decision making. Where's it going to happen? How is it going to happen? What actually happens? Again, if you've never been through it before, that word euthanasia, I mean, it probably conjures up all sorts of horrendous things, how do they do it? They don't just come in, do they, and grab hold of my pet and that's it. So it's really important to talk through what we do, how we use the drugs, how we manage the anxiety, both with the family and, dare I say, with the pet itself. Is it better in the clinic? Is it better at home? How are you going to experience this? If you've got other pets, other dogs in particular in the house who've been very close together, I mean, obviously I would encourage that to happen at home, although I'll discuss what's happening at the moment with COVID in 2 seconds. I would certainly encourage the other pet in the house to be allowed to come and see the older dog once the euthanasia has taken place. All these sort of things can be discussed up front. What happens to the body afterwards? I mean, this is another really important area for people to have a family discussion about. Nowadays, obviously, everything's cremated. All pets are cremated, but would you like a private cremation, as we call it? Would you like to have ashes back? In what form? Do you want to scatter them on their favourite walk? Do you want to keep them on the mantelpiece forever? I mean, these are all really, really important decisions to be making. And the time not to make it, Mark, is on the day of the euthanasia.
Yeah.
Be prepared.
Couldn't agree more. And even just the process, Wendy, I know it's a bit hard for his pet parents, but I think it's good to us understand, because I didn't quite understand it the first time round, and I didn't realize how fast it was. When the injection goes in, you think, I've got maybe 5-10 minutes. It's not. And thankfully, it's seconds. But I think it might be worth just talking a little bit about that process if you're comfortable doing that.
Can do.
And the drugs used.
Yeah, I mean, all vets do this slightly differently. I have always advocated using sedation prior to the euthanasia. So just because it allows the pet to relax more, and also for the owners to spend a little bit of time with them as the sedation kicks in. Now, sedation is just a drug or a combination of drugs that we would use before an operation for exactly the same reasons, just to literally let the animal relax. So it's a simple, quick injection, usually given into a muscle rather than into a vein. And it takes effect within 2 to sort of 5-6 minutes, just making the pet become a little bit sleepy. So I would always advocate that. I know some vets don't use sedation, and that again is their judgment call, but I always think it's just nice to let them get a little bit sleepy first, because obviously, especially if they're coming into the clinic, or even if I'm at the house, that's slightly unnatural. They're not expecting to meet me in their house, so they're going to be just a little bit uptight about life. Once they become sleepy, what we then do is we put what's known as an intravenous cannula into one of the front leg veins, just to assist having a portal to be able to inject a drug through. Again, this is something that's done very quickly and easily. It would be done before an operation as well, while the animal's in the clinic. So these are all very quick, safe, easy techniques to make sure your pet's as comfortable as possible before we give the actual injection. The injection itself is normally a high-strength pentobarbital, which in lower strength could be used as an anaesthetic in the old days, but now is only used for euthanasias. It's kept in a securely locked drug cabinet in all veterinary premises. And if we are coming to do a home visit, it literally is taken out, put into a safe storage in the car, and then taken back to the practice. So we have to obviously guard these drugs very, very carefully. because they wouldn't just euthanize the dog, I hate to say. So we have to be careful. So once that's all done and the animal is relaxed, and again, we hopefully would have had the conversation with the family as to who is going to be in attendance with the pet during the euthanasia process. Normally, I would see maybe mum, dad, and maybe one or two children in during the euthanasia process, although I have a personal feeling about ages of children being present during euthanasia, although they can certainly, come and cuddle their pets, etc., afterwards, or maybe even before the sedation is given. So I think there is a cut-off point for children, but again, that's something that we need to have a discussion with the owner, with the mums and dads. And then we just literally inject in an appropriate volume of the euthanasia drug. And as you rightly said, Mark, it's very, very quick. I would always say to my clients, that he or she will take a few deep breaths just as they're starting to feel sleepy, because that's part of the anaesthetic phase. It's as they just literally tip over into unconsciousness. Yeah. Some dogs will just start to breathe a bit more quickly. And I think it's important that we as vets talk you through that phase. The pet is not feeling anything. It's not knowing anything. It's just called an excitatory reaction to anaesthesia, to the drug, but it's nothing to worry about. In euthanasia, it passes very quickly. It's a few split seconds, and that's all. Once the anaesthetic drug has crossed the blood-brain barrier, then that's really it. The heart stops very quickly. Unconsciousness happened as the drug was being injected in. One of the things that might just unnerve pet owners a little bit is that although the animal is clinically dead, you might see some hairs moving. You might even see the tail moving slightly. Sometimes the lips tremble a little bit. These are nerve responses to the brain being dead. It's just as the body starts to cool down. I'm sorry to have to be so graphic as this, but I think it's important that we understand these different stages. I mean, your much-loved pet has passed over, but you might still see some tiny minuscule movements for just 2 or 3 minutes as the body starts to cool down. They may also evacuate their bowels and their bladder. So if it's a home euthanasia, I would always say, be careful, let's have blankets underneath them, because unfortunately, as we all relax in death, the sphincters open up, and you may then find that they'll void urine, and we don't want it all over your best carpet.
And I think these are important because as a pet parent, having just gone through it, you wonder if they're in pain or not. And I think knowing these small things when you're watching it, we're so detracted from life, and we're there at birth, but very rarely are we there at deaths of animals or parents or stuff. It's such a rare thing, but in other societies like in India, it's dealt with on such a different way. So I think it's important to understand that when the body moves or the mouth is moving afterwards, it's not that they're alive. It's like you say, and you will see this, and there's no guilt. It wasn't, they were in pain. And I think that's important.
Yeah.
For pet parents to know that, because, the more you're pre-warned about it, the more you're prepared. And hopefully you won't see all this, and hopefully it'll just be sweet, like it was with Morph the first time. We didn't have any of that. But, if you're prepared for it, it could happen. And I think that's really helpful.
One thing just to add, Mark, actually, is that I've talked about sort of euthanasia in normal times and normal circumstances, but unfortunately, right at the moment, the veterinary profession, like everybody, is not in a normal circumstance. And COVID regulations have definitely hit this part of veterinary life really hard, because we are very much advised not to do house calls at the moment. Obviously, for the risks of COVID transmission to our teams. We were also advised during the first lockdown to have nobody in the practice, although I have to say, being a pet owner myself, I just couldn't bring myself to not allowing one person in with the pet. So we have continued to do that, although we did invent a 2-meter long injection line so that we could administer the final injection from 2 meters distance. And that worked and still is working well for us. It's just one of the real problematical times to be up close with our patients. So again, I think you need to check and see what your veterinary providers are offering at the moment so that you're aware of how you can do it. I have done some garden euthanasias over the last 10 months, but it's a bit more difficult at this time of year to do that when it's snowing. But I think you have to have this discussion again with your vets, remembering that they too are governed by regulations at the moment, from the Royal College. Yeah. And one of the biggies, Mark, is pets don't always decide that the right time is 9 till 6 during the week. It might happen, things might go from bad to worse on a Sunday, for instance. So how do you deal with the emergency out of hours providers who will not, on the whole, come and do any home visits? They just can't. They just couldn't cover the areas that they're expected to cover. So I think you've got to be looking at what's available out there as far as out of hours provision is concerned.
Absolutely, and it's a good point, because we were trying to do it the weekend. Our local vets, who were brilliant, couldn't do weekend because they had an emergency call, would have to go to the clinic, and we wanted to do it as much, like you say, in the garden for Trin. So we had to do that on a Monday. So, but I think if we got out of COVID times, which are hopefully, fingers crossed, won't be too long, you suggested other places you've done it, which is more suitable. It's all about where it's comfortable for the pet, isn't it?
Yes, so, I mean, we have had pets, people who maybe didn't want to have a home euthanasia for whatever reason. We've actually done them in the boot of the car, which sounds a bit odd, but a lot of dogs are very used to being and traveling in the boot of the car. It means that their pet parents can be with them right through the whole procedure. It gets round a little bit the kind of one pet parent in the clinic at the moment. So we have done a few in the boots of cars. We just have to be sensible and as a team distance ourselves as much as possible. But, at the same time, it will allow a little bit closer contact for the pet owners themselves.
So I think that's really practical help and advice. And I think through this COVID period, if you can be a bit more prepared, and if you can make those decisions, as tough as they are, a little bit earlier, it gives you that time to find the best thing for your pet, which is ultimately what you're looking to get to, isn't it?
Yeah, I think I would definitely say, do not be afraid to consult your vet. I'm always amazed that still in this day and age, having been in the profession, dare I say, for almost 40 years, Mark.
Wouldn't believe it.
Won't repeat that one. People still come in with older pets whom I maybe haven't seen for 2 years. And their first thought is that the only thing I'm going to offer to them is euthanasia. That's what we're trained to do. You come in and we'll kill your pet. And that's going to be our first offering. And I sometimes just shake my head in disbelief that people still think that that's all we can offer. It's just to encourage people to actually speak to their vets, and do these regular checkups, what a difference they make. I do it with my own animals. I mean, my own dogs my older dogs always get blood tests done every 6 months at this age in life, because I want to spot things happening early. I've got it sounds like I'm a home for geriatrics. I probably am nowadays. I've got an 18-year-old cat whom we first diagnosed kidney disease on a routine visit a year ago. And he then suddenly became quite poorly, but we were prepared for it because we knew his kidneys were just starting down that road a little bit. Well, a year later, he's still being as big a pest as he's always been. He's on medication, he's supported, and he's doing fine. He's just going further and further into old age.
So test as much as you can. That'll help preempt things. Body language is another tell, but often the body language, these tests can probably get ahead of trying to read what your dog is trying to tell you.
Yes, they're great for monitoring. That's what I find it really good. Monitoring is the important bit. I can, as I say, I've my 2 old Labradoodles at the moment, their bloods are excellent. So I'm, keep fingers crossed. Their mobility is certainly deteriorating a little bit. And I think it's only fair to say to owners as well, the worst time of the year for obviously older pets and people is now, January, February into March. I think nature was very clever. Nature knew that it had to kill off a few oldies because we were going to have new life in the spring. So maybe nature, knows more than we do.
It just is. That's really, really interesting. So, and I guess the final bit is how you get back to normal. And, it's very easy to think that you're going to fill a gap up. But I don't think that gap needs to be filled. I think you should live with it. You should accept it. And I think going out there, getting a puppy, you know, all these things that you think about is going to, you know, I think personally, I sit here, go, I just need to take a bit of time before I do anything, reflect, and enjoy the good times.
Losing your pet, Mark, is a bereavement, and we need to treat it like that. We need to be, we as pet parents know that, but people maybe without pets don't necessarily see it like that. And I think some people who maybe work have a problem because their boss says, well, it was only your dog or only your cat or only your rabbit. I mean, I'm not saying all bosses are like that, but I think it's important to realise that this is a bereavement, and we all go through a grief process, whether it's a death of our parents or whether it's a death of our pets. And I'm going to say something a bit contentious now, Mark, as usual. Often we suffer more with a death of our pet than we do a death of our parent.
Well, they're there in the good times and the bad times, aren't they? You know,
Exactly.
they're literally there, and they're always happy that, you know, and I guess over the last, 20 years, I've had some tough times, really tough times, and they've always been there. They've never let me down. And I think that's ultimately what you want to do at the end, is not feel like you've let them down, no matter how tough.
Yeah, absolutely. And accept that this is part of life. And I think that's the important bit. It is part of life. I once heard a statement from an elderly GP who had obviously worked at times when we weren't just quite so politically correct as we are now. And they'd said, death has become very unfashionable. And I think that is so true nowadays. True. We've always tried to make death a sterile thing that we don't really get involved with. I mean, not many people nurse their parents or siblings or things like that to the point of death now at home, like they maybe did 50 years ago. We still nurse our pets, thankfully. But I think it's really important to be there for our pets. And you said something earlier, actually, I meant to pick up on. Pets don't have this same emotional attachment to their death as we do, obviously, or to their aging. But they also don't have the same emotional attachment to a diagnosis of a terminal disorder. And that's really important to remember. If your pet has been diagnosed with cancer, you know that. Do you think your dog or your cat could really care two hoots about that diagnosis? Of course they couldn't.
They just want you to chuck that ball.
Yeah, exactly. So it's really important that I'm not saying we keep our emotions in check, because that's maybe not a good idea either, but we do remember to just think about how our pet's viewing this at the moment. Okay, we've been diagnosed with a terminal condition, but really we can still go out for our walks, we can still eat, we've got a good quality of life. So let's not get too hung up on that. Let's just enjoy them, let's support them, and let's do some things to make their lives a bit easier in the environment around them.
Absolutely. And finally, for me, is don't think the last 2 minutes. Don't keep replaying that in your head, because that is not what that was all about. The ability to see that. And I've had to reframe it several times using techniques that I've used over the years to reframe and stop that loop going around and playing in your head, because you're just not doing yourself any favors by doing that.
It's a difficult one, because sometimes you do remember the last few minutes as opposed to the 12 or 15 years that you had previous to that. I always say to people, look, you've still got your memories, they're still in your heart, you will never forget them. That's the way to try and go forward, but give yourself time, because it is a bereavement. Do not try to sort of, as you say, internalize it all. Go through the stages of grief. That is really, really important. And if the way to do it for you is to go out and get another puppy, well, that's fine, but it's not always the right time or the right way to do things. So, I mean, just give yourself time.
Yeah, that's the key here. Time and reflect, get those DVDs out, get the Facebook memories on, and remember this time. Wendy, I really appreciate your input on this difficult subject, and I'm thinking a lot of our listeners will appreciate your help and advice there. And it would be great to put those links in that you've suggested as well. So I really appreciate that.
Yeah, lovely,
Thank you,
Mark.
Wendy.